HIV virus in the last 6 months. That is quite worrying. Hence, we decided to bring this conversation to your doorstep. Also, we heard that there are so many students who are getting infected with this particular disease. Now, this disease, as we know, doesn't have a cure. However, we have the antiretroviral drug that you can take to help you elongate your life. But then there's a way that you can prevent yourself from getting it as well. So today I have with me Dr. Fred Poku, who is the Director Technical Services at the Ghana AIDS Commission, and also Gifty Torkonu, who is the advocate at Ghana AIDS Commission. We need to talk about this particular conversation. We are streaming live on Facebook, so you can leave in your comments. We'll read it live on TV. You can also call us once we activate the phone line if you have any opinion to share, contribution, any question whatsoever. Please do join the conversation once the phone lines are activated. So I'll start my conversation with Dr. Fred Nunu, and I just want to know why this rise in numbers. What is happening? What are we not doing right, Doc? Can you please help me with that?
Right. Thank you very much. It's not interesting to have such numbers coming up, but we want to find out what's causing it. Mm-hmm. In public health, if you understand the mode of transmission, how the disease is transmitted, then you can institute measures or you adapt lifestyles that prevent you from getting it. Mm-hmm. So basically, it appears that most people do not understand how HIV is transmitted or how one can get HIV. Mm. And those who really understand that issue are taking it for granted, because now we don't see pictures of people who are emaciated, who are sick and dying on our screens. Mm. And also because we are a victim of our own successes. Globally, there is antiretroviral, as you rightly said. Yeah. So having the notion that there are drugs or medications that you can take to help you sometimes make people take things on the low side and for granted. So these are some of the causes of HIV. Granted that some of the factors include economic hardships that drive people to have sex in exchange of goodies. There's transactional sex. We talk about the students' bodies and all that. Trading sex for something, to get something, either cash or school grades, etc., etc. That is one other cause of it. And I mean, they look at the financial gains or whatever gains that they'll get and do not look at the long-term effect of having an infection such as HIV. Also, we have other concurrent public health diseases that marks the issue of HIV, especially those that are urgent and those that causes immediate effects that is obvious, unlike HIV, which you can have the virus for until about 10, 15 years, 20 years before you see the effects of the disease. Like COVID, within a couple of weeks, months,
you could lose your life.
You could lose your life. So people attach more importance to it than diseases like HIV. But HIV is real. It's still in existence and it's causing havoc in different dimensions.
Could it be that the media and the authorities are not putting too much emphasis on it, hence people have relaxed? Let me come to you, Gifty Torkonu. You are an advocate for it. I'll first ask you why you decided to go on this journey to educate people about HIV.
Thank you very much. I decided, or I took this move because I'm a person living with HIV. I've known my status for the past 19 years. And once I'm taking antiretroviral and I'm doing well, why won't I advocate for others to also know their status and be on antiretroviral? 80s, 90s, we're seeing boneless people almost dying, and there was no medication. So if today there is medication for you to live long, medication for you to live as any other human being, medication for you to live and get married, have children that will not have HIV, why won't you go for it? Why won't I advocate for it? That is my reason why I'm advocating.
For it. Yes. Right. Now let me ask you this. How did you get HIV?
That is one question I always ask my audience not to ask me, because there are many ways of contracting HIV. It can contract it from on-screen blood transfusion, using PSA instrument with an infected person, mother-to-child transmission, having unprotected sex with an infected person. And all I can say is that I have not had blood transfusion before using PSA instrument. Yes, I have. I'm not a kid. I've ever had unprotected sex. So I cannot tell which of them that's
you got it
from. So I always ask my audience not to ask me how, where, and when did I get it. I don't know.
You don't
But
know.
if you ask me when did you get to know your HIV status, I can tell you because I knew I was diagnosed on the 16th of April 2003. That is the only thing I can tell. How?
Did you just go get tested, or you felt sick before you get it, or when you were having a baby, you know, during the pregnancy they did test you for HIV? How did you get to know?
No, I got to know when I was a recruit in one of the government institutions, and we were asked to donate blood to Korle-bu blood bank, which I couldn't with other colleagues. So a few weeks later, our then director of study asked those of us who could not donate blood to avail ourselves for sugar diabetes test, and that is what we did. Sugar diabetes test, and then I was told I have HIV. So that is how I got to know. I wasn't told I was going to be diagnosed on HIV. Based on that, I lost my job. So if I have gone through all this, and in fact, it got to a time that I tried committing suicide, because my status wasn't kept to him alone, but it was spread everywhere, to the extent that someone will call and ask you, Gifty, we heard you have AIDS, not even HIV. And that time I wasn't equipped, well informed with HIV information and education. So those questions were pushing me to the wall that I became afraid. I have to stigmatize myself, not getting closer to anybody. So I ended up wanting to take my life. But God being so good, God intervened and I escaped it. So after escaping this death, what would you have done if you were in my shoe? And after some years, I got the antiretroviral and I realized that, oh, I thought when you have HIV, within 5 years you are dying, you become bolus. But neither become sick, I did not become sick, neither did I become bolus. I was rather looking beautiful. Why won't I go out there? Because why are people not going for medication? Why are people not testing? It is fear of discrimination or rejection. But if I can show to the country that yes, there is an evidence when taking the antiretroviral that you can live and live the normal life, why won't I? That is why I took this upon myself.
I like that you are being vocal about it. So now your family has accepted it, right?
If you don't accept, you cannot reject me, because whether you like it or not, you are affected. My family is affected because I'm a Ghanaian. Once I'm HIV infected, the entire country is affected. You can never rob me out of the family. But one thing I like about my family is that when they got to know my status, everybody embraced me. You know, I tried not to be a liability on my family. I tried to do something on my own. And there has not been a time that I would tell my family, I am sick, I'm lying in bed. Even if I'm not feeling, I'm human. I do fall sick.
Yeah.
But when I fall sick, I don't tell any of them. I don't fall sick because I have HIV. I fall sick because I'm a human being, I can get sick. So I try to live a normal life like any other person. For my family, they are solely behind me. And I love the fact that they are solely behind me. If they have not been behind me, I don't think I can do what I'm doing. So I salute my family.
That's fantastic. We'll talk more about that. But let me come to you, Doc.
Yeah.
I'm reading the statistics. I have Ghana's HIV fact sheet 2020. Number of people living with HIV as of 2020. 346,120.
Right.
The male is 116,000 and the female 229,000. Now, it looks like the woman is always higher than the men.
Yes.
Why is this so?
Right, as a woman, there are anatomical considerations that makes you more predisposed, okay? The nature of your external genitalia easily allows transmission to occur. So that is one basic factor. The other issue is that it is men. When you look at the testing rates, most of them are women because of pregnancy testing and other associated factors. They are sick, they go to the facilities So most women test more than men. So you will find out that more women are diagnosed with the viral infection than this thing. Then the other confounding factors, economic conditions, right? It is true that a single act can let you have HIV. It is equally true that having multiple concurrent partners predisposes you, increases your risk higher than not having multiple partners. So you can find out that the sex workers as a group have higher prevalence, higher incidence. Right now it's about 4.7% among the
sex workers?
Yes.
Okay.
Even had decreased from a value of about 11 to 4.7 due to the interventions and the kind of programs that we hold for them. So women in general, apart from their anatomical considerations, the other social factors that predisposes or put them at a position where they easily get infection. So that is one. And when you you look at the youth population as we talk, the same 2020 statistics shows that more than 55,211 youth aged between 15 to 24 acquired the infection. Out of this number, more than 80% were women or girls or adolescents. But
there's a possibility that the men have it, but they're just not getting tested, right?
Yes, that is also, everybody has it, I mean, including women, children, and everything. Yeah. But the testing rate among the women are higher,
right.
So you identify them more. But they are also predisposed based on the factors that I have already explained.
Now, talking about society, are we a contributing factor to, you know, the increments? Because I'm looking at, you know, how people are driving luxury cars, people are living a luxurious life on social media, and it's actually influencing the young ones as well. Auntie Gifty, you are an advocate, so you've spoken to a few people. Have they told you about that?
No, no one have ever told me, because I wanted to have a car or house, that is why I'm going in for it. But sometimes it's based on the economic factor, maybe not having anyone to take care of it, because most of the young ladies I have spoken with, in fact, I sometimes help at the fevers unit in the fevers unit at where HIV clients are being taken care of. And when anytime I meet young lady or young guy being tested or coming for treatment, my heart beats. I go home crying, and it's not because she cannot do something for herself in the future. I am grown. After all, I have gone through a lot, and I am strong. What about them? Maybe 25, 22, 20, some as young as 19 years. And when you ask, someone would tell you, maybe I was raped. Someone would tell you, because of poverty in the house, I had a boyfriend and I have to be with that boy. Maybe out of that I had. So, you know, I cannot even say out of that they have it. But when you listen to them, it tells you that it is not because I wanted to have a car, I wanted to have this, but it is because sometimes it is because they don't even have money to buy, Rebecca said, money for Poku. That is why they go into this. And then some too, it is because of bad or negative parental guidance, peer pressure, and stuff push them into that. So for me, I wouldn't say.
But it's more of economic hardship. Are we then going to say that we are going to see a rise with this kind of economic hardship Ghana has gone into?
It's possible. You see, I was saying this by observation. Men will want to have sex to release tension, in quotes, or to distress. On the other side, women really want to have sex out of happiness or joy.
Or love.
Or love, as it is. So, in either way, whether there is hardship, where a man is stressful, he might just go out and have a lot of women, and that increases the risk if they don't use protection, condoms. When ladies are also happy, they are loved, they feel good, that they crave for more sex and belonging. And
now, you did mention that you go to the secondary schools to educate, right?
Yes, there is. We have civil society organizations that goes into the schools to educate. We try to form youth clubs in the schools to help in educating the youth about HIV and AIDS. We're even currently thinking that we get people to do condom activations and campaigns in schools and in the lorry parks and things, based on these statistics that are coming up.
If we are doing all the education and there's still a rise in the secondary school sector, then what are we not doing right? Is it that we should just share condoms? Will that help? Because when you look at the West, a place like UK, you know, they have these youth centers that you can walk into and get a condom once you're sexually active.
Yes.
And nobody judges you for that,
right.
You know. So can we create such, you know, centers for the youth? Just walk in there and get a condom for free.
Certainly. It's a combination of a lot of factors to help reduce the numbers and bring the infection down. Condoms are very good. They produce dual protection, STI, other STIs, pregnancy and all that. So we will have to look at distributing and ensuring that condoms are freely available. But again, our mentality is also very important. That is why the education has
the condoms are expensive, so if we give it out for free, help.
We have free condoms. Okay. We distribute free condoms. There are program condoms that are being distributed, and some are as cheap as 3 for 10p.
Where do we do the distribution?
Anyway,
to the young ones, they don't work. So even if we are selling it, it's still expensive. Whether it's 10 pesos or not, it's still expensive. So where is the distribution center for these young ones to be able to walk in there
and pick? Yes. So in programs, during programs in the communities, it is being distributed by civil society organizations. But as you rightly said, we could looking at the other channels of distribution of the condoms, right?
Should we look at churches?
That is if my advocacy.
What do you think about it?
For churches, you know, I don't know how to put it, but maybe the church might think you are promoting sex. But we should understand that, yes, we have adolescents in the church who are having sex, whether you like it or not. It is because we have not seen a pregnancy, we think they are virgins, or what? The church should be able. But now, you see, it is not those days that children are taught about immorality, and they go by it not to be immoral. Today, whether you talk about it or not, these children have phones at young as 2 years is using the phone, and what these children are watching on that phone, you, the mother or the father, are not watching. So I think the best thing for not the public but the parents. Children spend much time with the parents. So parents should rather guide our children. You see, don't think because I am not infected or I don't know any of my family member infected, so it cannot come to me. We should start right from the house.
So children should start giving their children condoms.
I'm not talking about education.
Sometimes
I sometimes against giving condom to adolescents. I, Gifty, can never, ever give condom to my adolescent child.
Why?
I wouldn't do that because I need to educate my child to do away with immorality. Because the child must, as a child, what you need is education. I am working for you to go to school.
But there's a case whereby the children are doing it and they will not let you know.
But you see, it's runs on education.
Right.
When you educate those children and you put fear of God in them, they will not.
Okay, Doc, you want to say something?
Yes, but I want to say something. This issue about condoms for adolescents had been a very big challenge over the years, and we're still grappling with it. In fact, last week, or the last 2 weeks, there was a meeting with the Ghana Education Service staff and other partners, and it came up, policy about condom distribution or condom availability in second cycle institutions. I mean, those between the age, adolescents and between. Statistics that they had shown from Ghana Health Service, 14 years, 10-year-old are getting pregnant.
That's it.
You see, they are getting pregnant. And the fact is, the education is good. we will have to do that. But we have to look at the entirety,
the holistic on the ground,
the holistic approach. Okay, if I put this thing here, and you are not a thief, you pick it, you come asking whose wallet is this, or whose glasses are these, and you try to find the owner. If you are a thief, I put it here, you pick it and put it in your pocket and go away. In the same way, if I make condoms available, and your education and your understanding is that it is for adults or whatever, and I don't need it, and as you say in quotes, your morality is right, you will not go using it because it is available. But if you know you have a problem, you can't contain or resist the urges that comes naturally sometimes due to the hormones that are changing in your system, and you can't restrain yourself, and you think you want to have sex, then you might go pick it up and then protect yourself, knowing that it is going to help you from becoming, getting
pregnant or getting the infection
or other STIs. So it is neither here nor there, and we are in talks. We are all discussing what is the appropriate age bracket in which we should make condoms available. What is it? Looking at the data, looking at whatever, and looking at all that is happening, things might have changed. Okay, the world has changed. Things that are not in existence today, yesterday, are in existence today. Those times when we want to make a call, I remember you have to walk to a phone booth in the Ghana Telecom somewhere before you can join the line and everything, before you can make a single call. But now you sit anywhere, what, and do all that.
Right.
So technology has changed, understanding has changed. Do we need to look at some of the laws? Though they have been in existence for the past 10, 15, 20 years, and modify it in order to save our children and save ourselves? I'm not an advocate for moral decadence, but we need to keep a good balance of the issues and look at policy. Our organization is about policy making as well. So we look at all the policies.
But you still haven't had the age bracket yet, right?
Of providing condoms?
Yes. When you look at the statistics, what is the age that children get very active in sex?
You see, they experiment right around the ages of 16, 18.
So maybe we should look at the secondary schools?
Yeah,
but it looks like we have to go down to the junior high schools now.
Yes, we have to look at all that. We have to look at all that.
I want to activate the phone line. I'll answer only 2 phone calls today. I don't have enough time, so only 2 phone calls. We are talking about the HIV infection on the rise. Now, it's quite worrying because Daily Graphic did report yesterday that we have over 23,495 persons who have tested positive to HIV. Now, the sad part is the youth. That is where it's quite worrying, because these are people who are supposed to carry the country one day. You know, as much as there's the antiretroviral, we also need to preach. Abstinence is quite difficult now.
Right.
We are preaching abstinence, but it's difficult because of society, because of what is happening on the internet, because there's so much, access to bad stuff on the internet. So what can we do to prevent HIV from spreading? Another thing is also the LGBT, which is on the rise as well, and it also actually affects HIV. Doc, you want to speak about that?
Sure. Certainly, we know that men who have sex with men, there is an increased tendency to get HIV because of the anatomical disposition of the anus. And then, like how there are a lot of blood vessels which easily break, and there's easy transmission. In fact, they have about 4 or 5 times risk of acquiring HIV than the general public. So that is an issue. And in terms of public health, it is one of the key issues where we have HIV transmission. So we don't need to encourage that. That is why programs are in there that those who are into that, we not being, in quote, religious bodies, look at the scientific methods of prevention and encourage or give out condoms.
Right.
So that they become healthy and not affect the communities in which they are. So that is our aim.
That's the aim, and I like that aim. Let's go on our phone line. We have our very first caller. Prince, good morning. You're calling from Medina.
Good morning, please.
Talk to us.
Okay, so I want to just share my views on this. Actually, propagating the good news in SHS is very good, but I think those that, after the education, those that are willing, it shouldn't be by force, but those that are willing to take the contraceptive should be allowed. Because nowadays, what we think the children don't know, they know it, they learn it everywhere, they learn it in schools, from friends at home. Although you might think you're educating your child, but your child also sees something everywhere and then pick it, doing it without your consent. So I think as far as we are, we shouldn't force them. Those who think they can go for it, we should give it to them. So the education should be done alongside sharing the contraceptive to them.
Right, thank you so much, Prince.
Long run or prevent it.
All right, Prince, thank you
but
very much.
Our first concept to them is they should abstain from it totally as far as they are at the adolescent age, and then concentrate more on their books. Yeah.
All right, thank you very much. Let me go to Mohammed. Good morning, Mohammed. How are you? Kindly lower the volume of your television set anytime you call. So I'll pick just my one last caller, and then we can round this conversation up. But Doc, I did, and Auntie Gifty, I did talk about the churches because, most of the charismatic churches, they carry more youth in their churches. And the youth believe that if a pastor should tell me that I should do A, B, C, D, is good for me. And they will listen to the pastors more, because the thing is, it's happening, it's a fact. So that's why I brought in the churches. And do you think your institution should reach out to the churches to help advocate, HIV in there?
We do already reach out to the churches, but there are some categories of churches who are a bit reluctant when it comes to issues about HIV, issues about condoms and all that. And as you were saying, it creates the impression you are condoning and conniving to have immoral
acts in the church. Let me go on the line and then we talk about it. Sorry, I'm picking my last caller. Hello, good morning, Comfort. You're calling from Sunyani.
Good morning, Mother.
How are you?
I'm doing well. What about you?
We are fine, thank you. Do talk to us.
I love the program very much.
Thank you.
I just tuned my television to the program and I love it very much.
Oh,
I'm a midwife, and the essence at which we are getting the HIV clients is very much. But the parents can, if they can talk to their children and also tell them more about sex, so that the rate at which the HIV can go down. Thank you.
Thank you very much. Very, very grateful. I think what she's saying is very true. Auntie Gifty did speak about it earlier. Now, the thing again is, how do we let the society understand that condom is not bad? Because currently, that's how it seems. Even somebody to walk into a pharmacy, even an adult, to walk into a pharmacy to purchase condom is like a no-no. So I would rather not go to the pharmacy. Let me just cover my shame and go and do my thing without going to the pharmacy. How can we let them know that it's okay?
For me, it's bound back to education, because if you are well educated on on the negativity of having unprotected sex, I think I would rather go for protection. So I think the education should be intensified. We should rather intensify the education so that people would understand. Because, when COVID came in, the education on COVID was higher. So many people thought that COVID has taken over HIV, which is not true. So I think we should, things that maybe we've gone for break, we should come back from break. The NGOs that are into HIV education must wake up. We have to encounter our education so that people will understand. Every corner, there should be posters and what have you. Somebody might not read, but even look for pictures or ask someone to educate her and tell her why, the meaning of that. And then the communities, we should be able to be doing those things in the communities. You see, when it is every day, all the time we are hearing this.
We are hammering on it.
Yeah, someone will be curious. Why is this thing going on? The person will find out to know. And when they find out to know that, yes, ABC is causing us harm, then we have to withdraw from it. Because look at the youth. They are the youth force, let's say the future leaders of this country, are rather getting infection. I'm not saying that when you have infection, you die in the next 20 years or in the next 30 years. When I had HIV, when I knew my status, I was 29. I'm now 48. So I'm not saying you will die in the next few minutes. But again, this is an infection that comes to you. You have to be going to facility. You have to take your medication and stuff. And sometimes you see your life not being normal. For me, I see my life being normal. But somebody might not feel the way I feel. So I think we should have, education should be every corner. If we have gone back to sleep, we should wake up so that people will know that, yes, HIV is still real.
Right. Doc, let me take your final words.
Right. So thank you very much. So AIDS and HIV is real. And we must protect ourselves from getting it. Reduce risky behaviors, irrespective of your gender, irrespective of who you are and what you do, and especially the youth. When you get HIV, it is not only an individual matter. It becomes a public health issue. There's more stress on the public health service delivery at our facilities. Government spends millions of cedis to bring in the antiretroviral drugs, which are for free. And it is taxpayers' money as well. So HIV, having an HIV infection, and it's for life. It's not...
You know, my producer was just saying something to me.
And over 56 million.
Yeah, so my producer was just saying something, and he said that, back in the day, we had adverts that, like you said, we were seeing pictures of how deteriorated you can be, the state, and it actually did prevent, unprotected sex. People were scared to get HIV.
Right.
It looks like the promotion of antiretroviral is actually encouraging more people to go unprotected. Can that be?
No, that's what I've said.
Yeah. So we need to
promote a victim of our successes. We have antiretroviral. It helps. Prolongs your life, make you healthier and everything.
So now people are on the loose.
Well,
we can't be bothered.
We can't be bothered. But that is not the issue.
HIV is the new malaria. That's how it looks like.
Yes, I agree with you on that. But that is not the way we should go. That is not the way, apart from the individual, burden of every day picking medication.
It's something
else.
It's
something else.
Right.
And very soon, I'm sure, if we continue the way and the money that are pumped into HIV programs and HIV medication, you might have to sell the HIV.
Let's have more adverts. Let's have more adverts out there. And then people will now
feel the pink in their
I think that you should put out adverts out there. Please do. Let's see how bad it can be if you should get HIV. The antiretroviral adverts are out there. Please, let's put the reality on the ground out there to prevent it from spreading. The number is too much. So as you go out there to talk about HIV, talking about antiretroviral, please talk about how bad it can be for anyone who gets it. Please and please again, let's let them know what it takes if you have HIV/AIDS, so we can prevent the spread. Thank you very much for watching Beyond the Headline segment. Thank you for being here, Doc.
Thank you.
And thank you for being here, Madam Gifty. I've been speaking to Dr. Fred and Nana Poku, who is the Director, Technical Services at Ghana AIDS Commission, and also Gifty Torkonu, who is an advocate at Ghana AIDS Commission. And we've been talking about HIV infection on the rise. We'll take a quick break. When we come back, we are talking about abuse of drugs. Yes. That is how bad it's getting in the youth, amongst the youth. It's getting really, really bad. Let's talk about that right here on the show. Stay with us.
Every morning is an opportunity to take your hustle to the next level. Every morning is one day closer to your ambition. So, start every morning with the right motivation to make every day count. Start strong, finish strong. Nescafe.